Good morning and thank you for joining us here in the 17 Newsroom. I'm Maddie Jansen and we're breaking into programming to bring you the latest from the Kern County Public Health Department on the coronavirus crisis. They're set to hold a news conference coming up in just a few minutes. They're getting set up right now, but here's what we know so far, and these numbers were just updated. We still are sitting at 5 residents who have been tested positive for coronavirus and 1 non-resident. So that's a total of 6 cases here in Kern County. So far, there have also been 185 negative tests and 292 tests are still pending right now. Again, this is all amid the coronavirus crisis, which continues across the country. Let's take a look at the numbers for the U.S. There are more than 35,000 people who've been affected with COVID-19. 471 people have died. California, Washington, and New York are the 3 states to have been hit the hardest. The National Guard has been activated to help. In addition, 2 U.S. Navy hospital ships will be put into service. Today, the USNS Mercy is headed to Los Angeles. That vessel will become the biggest hospital in the city, according to Mayor Eric Garcetti. There are 1,000 beds on board, and Garcetti says the ship will save lives. I want to talk about those local numbers one more time because, again, they were just updated over the weekend. 2 more cases tested positive here in Kern County, bringing us to a total of 6 positive cases here in Kern County. 5 among residents, 1 among a non-resident who was in Kern when they tested positive. Kern County Public Health also notes that these cases do not appear to be related to each other. So that's another interesting fact here that we're talking about. Again, there have been 185 negative tests so far as well, and there are 292 tests still pending. Right now, testing has been rolling out kind of slowly. Tests often have to be driven out of town to be done. Dr. Hemel-Cothry was with us here this morning on 17 News at Sunrise. He's with Dignity Health, and he says they actually have to take some tests to Stockton to have them done, but they're done in a few hours, and then we get the results back. Of course, just late last week, a new test that will come back with results in about 45 minutes was approved. He says it will be several weeks, however, before we get those tests here in Kern County and are able to start using them. Meantime, let's talk about testing sites here in town that are running tests right now. There are several of them. And officials do believe that as we see testing start to pick up, we're going to see a spike in positive cases. Accelerated Urgent Care offers drive-through testing on Coffee Road and Stockdale Highway. Priority Urgent Care is also testing from a tent at all 4 of its locations. Omni says it's also testing at all of its clinics and offering drive-through testing. Local hospitals can also test for COVID-19 as well, but please remember they're only testing people who show symptoms right now. Public Health acknowledged testing is not completely free, but Director Matt Constantine says they're looking at options to help with cost. Of course, the price will also depend on your own insurance coverage. All right, well, let's talk about those symptoms. Since they're only testing people with symptoms, what are they? How do they compare to symptoms of the flu or allergies, which are also going around right now? Symptoms of coronavirus include fever, a dry cough, meaning there won't be mucus, fatigue, and shortness of breath. Less common symptoms of coronavirus include aches and pains, a sore throat, a runny or stuffy nose, and diarrhea. Flu symptoms are similar, but muscle and joint pain, a runny nose, and headache will be more common for the flu. A lot of people have allergies right now. It is now spring officially. Those symptoms for allergies include sneezing, coughing, itchy eyes, and a runny or stuffy nose. Again, if you think you have symptoms of coronavirus, call your doctor before going to the office or go to one of those testing sites we just told you about. Late last week, Governor Gavin Newsom ordered a stay at home, so there are a lot of things that have changed over the weekend. We'll talk about that in just a moment, but let's go live now. Michelle Corson, PIO for the Public Health Department, is now speaking.
Kern County. We have, the California Department of Public Health has confirmed that there are 1,468 cases of COVID-19 with 27 deaths. 1 is a non-California resident, and this is as of March the 21st at 2 p.m. Here in Kern County, we have been notified of 30 returned travelers. 22 of them have either not required monitoring or have completed their 14-day monitoring period. As of March 23rd at 9 a.m., the Public Health Services Department has been notified that 185 results are negative for tests that have been conducted in our community. 11 positive tests have been detected among residents and 1 positive test among a non-resident. 292 tests are pending. While we are still investigating all of these cases, it is likely that community transmission is now occurring in Kern County. Unfortunately, now that we have reached the threshold of 5 total cases in our county, we are able to provide cases in a broad geographical level. So now I'm going to introduce Kim Hernandez. She is an epidemiologist who can now discuss those cases by region.
Thank you, Michelle. I'm going to pull something up on our website very quickly for you all.
Was that 209 or something?
It's 292.
92.
292. So the California Department of Healthcare Services has guidelines that prohibit releasing data until we reach a certain number of cases within a defined population to ensure that patient confidentiality is maintained, excuse me, and that the department remains in compliance with HIPAA. And now that we do have 11 cases in Kern County, the state guidelines allow us to release information by geographic regions of 100,000 people or more. We have combined Kern County zip codes into 5 regions, which we are calling Valley, Bakersfield West, Bakersfield East, Mountain, and Desert. As of today, 1 case has been identified in the Valley region, 8 cases in Bakersfield West, 2 cases in Bakersfield East. This map will be updated at the same time as our case counts on our website.
So we wanted to address, there's been a lot of questions and discussions about PPE in our community and masks. There is no known shortage of PPE, including masks, for medical providers and first responders in Kern County. The county maintains a supply, such as PPE, to be prepared for events such as this. The county has been able to fulfill all of the PPE requests submitted by the hospitals and still has supplies on hand. Homemade masks do not qualify as approved PPE. Some good news, last night in the rain, we received 300,000 masks donated by PG&E. So that is a welcome gift at a time like this. So what can we do? We still encourage our community to pay attention to Governor Newsom's executive order to stay at home, except for operating a critical infrastructure. And, use your common sense approach. If you are out and about, practice your social distancing, wash your hands, and check on your vulnerable neighbors in the community. And you can still get outside. You can still take walks. It's clean, fresh air today after a rain. So we just want to remind our community of that. We also want to remind our community that on a daily basis, our website is updated. Now the new map will be available for folks to make reference to. So please visit kernpublichealth.com on a regular basis. Follow us on social media. That is Facebook, Instagram, and Twitter. We will be posting regular updates and pushing out really important information to our community. And at this time, I will go ahead and open it up for questions.
So you say that due to HIPAA regulations, you were not able to previously disclose more the regions geographically that these cases were in. How many cases did you have to hit in order for you to be allowed to now do that?
5.
5. And to be clear, you said there were 11 now, though?
Yes.
So there are 11, well, as of yesterday, there were 5. Now there are 11 positive cases
Yes.
In one of those that's included is the non-resident. Is that right?
No. No, I'm going to let Kim address this.
Okay.
So we've had 11 cases in Kern County, which is what our map shows. There is that one non-resident who is not included in our total of 11 Kern County cases.
Got it. So it's 11 plus 1 of total positive, 11 residents, 1 non-resident, to just be clear for everyone. Great.
And also, what about the positive test at Edwards Air Force Base? Is that part of the 11?
That is not something we're going to reveal.
Because they may not live there, right? Is that right? They may not live they don't live at the Air Force Base,
What we are going to be able to say is what is on this map, and of the Kern County positive cases, this is how we're going to identify. We won't confirm anything further than that.
And what are the rules and protocols, again, when it comes to knowing about like age range and other things that other health departments in the United States are able to share?
So as we get more cases, substantially more than we have now, there is the ability to further provide more information about cases. It has to do a little bit about the time frames that we're looking at, as well as how many cases we have, to make sure that we are not breaching HIPAA and that we are not providing any information that could potentially identify some of these patients.
Sorry if this question was just asked, but is this where they contracted, but it's believed they contracted the disease, or where they reside now?
This is where they reside.
Okay. So this is not believed to be the area that they contracted the disease?
That's unknown.
Okay.
Of these 11, do you know, or are you able to disclose how many were travel-related versus how many were intra-community transmission?
It's unknown. Yeah, we're still investigating. This is moving very, very quickly. So we are definitely still investigating each of these cases to make that determination.
There were a few measures that Matt Constantine said why he assessed our risk level to be low last week when we spoke on March 17th. One of those was there was no residents in Kern County that there was a positive ID for the disease, and that there's no evidence of community transmission. Now those are here. What is your assessment of our risk level in Kern County?
Well, the risk is there. This is to be taken seriously. The stay-at-home order has been issued, the stay-at-home recommendation has been issued. So this is a time to really pay attention to what our leaders are telling us to do. Here at Kern County Public Health, we are aligned with the state's recommendations, the governor's recommendations, and the Centers for Disease Control. So it's a time to adhere to these recommendations and take care of ourselves and each other.
So to
Is
be
there a
clear,
place
are
where
we
people
no
who-
longer a low risk level? Are we now higher than a low risk level?
Yes, at this point, that is evident with this, the changes that have been occurring. We're seeing more confirmed cases. So yes, that's fair to say.
Okay.
Is there
So
anything
for
different
my
changing
education-
for the people who are still going to work every single day, whether you're cleaning hotels off the I-5 or really going to the grocery store, some of the grocery store? Any extra guidelines being held for them? Any mandates as far as masks, things like that, PPE and such?
So the Centers for Disease Control says that wearing masks is not a recommendation for the general public at this time. What the masking is for and the protective equipment, these are for our healthcare providers, our first responders. If you are sick or if you are someone that is taking care of someone in your home, that is when wearing a mask would become important, and that's when it's recommended.
Michelle, forgive
Not
me.
For all of us, it's social distancing. It's cleaning those high contact surfaces. All of the recommendations that are in place because of the stay-at-home order at this time, recommendation, that is the precautions our community should be taking.
Michelle, forgive me for continuing to inquire about this, but just because this is a sensitive topic and, phrasing is very significant. Matt Constantine phrased it as a low risk. Now that you're saying that the risk is higher, what is the proper term we could use to describe that risk? Mid-risk, or what is the proper terminology there?
There is community transmission, we believe there is community transmission happening in Kern County. So what we are prepared to say is that we are at risk. The low risk was when we had, lower amounts of cases, but as we continue to investigate this, and this is something that's being discussed statewide, nationwide now, so that's what I'd be willing to say at this point.
Are all 11 cases recuperating at home like they were last week with 5, or are any of them requiring hospitalization?
They are all recuperating and in isolation.
You're not able to disclose whether in home or in hospital?
No.
Okay. In terms of those N95 masks, are first responders, like you said, like law enforcement, police officers, firefighters, are they now also all wearing those N95 masks?
So with each of those different professions, but yes, our first responders, our healthcare professionals, these are the folks that are submitting and getting requests for masks and other personal protective equipment.
There's a Facebook post circulating that says helicopters are spraying disinfectants to eradicate coronavirus. For those people out there who are wondering and watching, can you clarify?
Yeah, there is nothing like that going on in our community to my knowledge. Yes.
These 11 cases here, which ones of these, if any, are at-risk populations?
Can you clarify that?
At-risk populations, as I understand it, are the elderly as well as the young, if I'm not mistaken. It's a proper term, I understand. Which of these 11, if any, are at-risk populations?
Oh, I'm not aware, and so I can't answer that question.
So-
And we're still conducting a lot of our investigation. But yeah, no more identifying information I can give on that.
I'd like to say, first of all, I think the public really appreciates that now they have a general idea of where these cases are. I know that we didn't hear anything about the measure being over 5 before locations could be passed along. What kind of conversations were there? At what time did you guys decide that, 5 is the number? Because I never heard of that.
I'm going to let him come up and address that.
So 5 is one of the many numbers we use in assessing the risk of identifying information. It depends a lot on the number of cases as well as the geography that we're using. So we've been working hard to figure out at what level we can allow this information to be presented publicly without risking these individual patients. And so this has taken some time that we have been assessing, and we have been determining what that looks like and how we move forward with that.
Now, okay, so on that note, is that just unique to Kern County? Because I looked at 12 different counties in our neighboring county, and even with their first few cases, they gave a general location and a general age range. So is that just unique to Kern County? I also spoke to some of the directors of public health, and they said that they're not violating HIPAA or their ethics by providing that information for the public to know. What is your comment on that?
Every county has their own process of how they publish information. We follow the Department of Healthcare Services guidelines that are, that are publicly, they're posted, you can find them, and that's what we use to identify for all of our information that we post on the website, that we provide publicly, of whether or not it is acceptable. When it does not meet those parameters, we do as much as we can to further de-identify information so that we can provide as much information to the public without violating HIPAA, without violating privacy, or risking the confidentiality and the confidence of the patients in our community.
So with that said, are you guys going to be releasing age ranges now? If not, why not?
Not at this time, because based on these guidelines, it would not meet the criteria for public release.
So I'm sorry, let me just stick with you for a second here. So other health departments said that they provide age ranges because it's important for the public to know that this affects not just seniors, right? We know that there's younger individuals who, have been covered in the media going out, not practicing social distancing, and putting themselves in vulnerable positions because they're like, oh, my age, it doesn't matter to me. Do you not think that it's important for our county to know whether it's all senior citizens or a range of ages?
It is important to know that we are all at risk. it is important to know that there are numbers on a national level that are being provided to us. Here in our community, we are going to protect and we are going to follow the guidelines, but young people and our older population, we all need to be taking the precautions. We all need to be social distancing, and I think that's important for all of us to remember at this time. Yes.
Now, one of the activities that is still allowed is, going outside, going for a walk, as long as you maintain social distancing. But, going outside myself this weekend, I saw that a lot of parks were packed. This morning, the LA mayor decided to shut down parks and recreation in many areas. Do you foresee that being an issue in Kern County if the only thing people are allowed to do is go outside?
No. At this point, we're working to get these recommendations have come quickly. We're getting the word out, our city and county, to businesses and residents about what does it mean to have a recommended stay at home. And so at this time, there's no need to regulate that. We trust that our residents, as they learn of this, they are going to be doing the right thing. And so there is no, we're not looking to do anything different than continue to educate and continue to have our residents understand what it means to social distance.
So I understand public health on a regular basis. You can go around to different restaurants and establishments, and you can shut them down if they're not following code. I understand this stay-at-home mandate, shutting down of non-essential businesses, that's not really going to be enforced by law enforcement, as Governor Newsom said. But does public health have the ability to, let's say, shut down or recommend closure of a quote-unquote non-essential shop, something like a gun shop or ammunition shop, something like that? Do you guys have that ability?
At this point, we have no regulatory authority. We, under Governor Newsom's proclamation for this, we are providing the information. We are talking to businesses, and so this is an evolving situation, but for now, we have no regulatory actions that we'll be taking. Yes?
Okay, with regard to the hospital supplies, it is our understanding that there are shortages of various supplies, including rubbing, alcohol, gowns, gloves, as well as masks. You said that the county is fulfilling all orders. Can you tell us a little bit more about that in regard to reports that we're receiving that there are critical shortages of certain things?
So I can speak to the requests that come to us, the masks and the personal protective equipment. We are filling all of those orders. There is no shortage. When it comes to some of the products you just mentioned, I'm not able to speak to that. I'm not aware.
How are we doing on the supply of tests and the ability to keep testing people?
So with our testing, all of our hospitals are able to test, and we have accelerated urgent care, priority urgent care, and Omni. They're also conducting tests. So at this time, there is no testing shortage in our community. Yes?
Again, regarding supplies and the inventories, what are the best and worst case scenarios for how long existing supplies at hospitals and clinics will hold out?
Say that again.
The best and worst case scenario for how long supplies will hold out.
So at this point, what I can address is all of the orders that are coming to us. So we facilitate the personal protective equipment, the masks. We are filling all of those requests, and we have no concerns at this time to be able to fill those requests.
So no estimate on how long your supply and the hospital's existing supply will last.
For now, we continue to hear information about it coming down from the state and the federal to give us ongoing supplies. So at this point, we can speak, we have no shortages now.
And then, I know we can't talk about ages, but can you answer whether anybody in the public sector, public safety, healthcare providers, police officers, firemen, have any of those, are those in any of the positive cases? I'm sorry, I should ask that again. Have any of those people in the public sector who, work in public safety tested positive for COVID-19?
I'm not able to answer that.
Okay. Is there going to be a number next week that we're going to find out, like, if we get more than 20 cases, then we can release ages? You know, just kind of like the measure that you guys had for when you could release locations. Is there a measure now for how many cases we need to have in order to release ages? Or can we just go out now and say, you guys aren't ever going to release ages? It doesn't matter if we get 1,000 or 20,000, that's going to be out of the ballpark.
I'm going to let Kim answer that.
So as we get more cases, we continue to assess and we look to see if there are other ways to aggregate data in order to be able to provide more information to the public. So we don't have an exact number at this time. It's an ongoing basis where we look at different methods of presenting data to make sure that we do continue to protect privacy, but that we continue to get information to the public.
Okay, so what does that mean? So are you guys going to look at whether a certain amount of, does it have to hit a certain number in order for you to release ages, or are you saying you guys are just going to look at how you can present information?
So there's a number of things that are taken into account when we determine whether or not information can be released. And so as those are constantly changing, in addition to the number of cases, we're looking at the geographies, we're looking at the time frames that we're looking at. And so as those things change, we continue to update to see at what time we can provide more information.
And are any of these protocols listed on the website that we can identify ourselves, or are these just conversations that healthcare providers in our county are having?
This is state guidance. This is HIPAA. And I think what's really important to remember, what our public needs to know to protect themselves and to maintain public safety, we're going to let them know. So this is what we as a county are prepared to release today. This is a fast evolving situation, but we are going to continue to release the information as it's appropriate. So I think we can kind of move on from this at this point. I think we've said that. Yes?
For how long has the county been providing PPEs to the hospitals, and where is the county supply coming from?
So this has been, we're prepared for this. We practice for this. We work with our hospitals, and we have extra reserves of PPE equipment for such a time as this. And so when it comes to the COVID-19 situation, we have been working with them for weeks and ensuring that their supplies are there. We started communicating with our hospitals and our first responders weeks ago on this topic in the preparation for this time. And we get this, again, from the state and federal. So, and luckily a gift from PG&E recently. So I think at this point, we will continue to see that flow of PPE come our way because of all the initiatives that are coming forth from the federal level especially.
So how is it that other states, New York in particular, is seeing a dire shortage of PPEs? California, and you're saying federal sources all have plenty. How does that work? That some states have plenty, Kern County, some states don't. Kern County has plenty. How does that work with the supplies, and we're doing fine?
I can't answer for the other states. I can just say what is happening in our county. And in our county, we do not have a shortage, and we are getting ample supply to meet the need that we are facing, currently.
Had we not gotten that gift from PG&E, would we have been low on supplies?
No, we wouldn't have. It was a welcome gift still. Yes.
How is the consumption of equipment, such as PPE, but not limited, again, gowns, masks, rubbing alcohol, how does consumption of those supplies change at a time like this? Is it, for example, double, triple, or what is the ratio of normal consumption to consumption at a time like this?
You would need to perhaps talk to each of the individual hospitals and their supplies, but clearly this is a time where the need for all of these things are increasing. Therefore, we have the reserves to meet a need such as a time like this, and more is coming our way. So it's your local health department's responsibility to receive the requests from these first responders and local healthcare facilities and get the appropriate equipment out to keep our first responders and our healthcare workers safe and protected. Any other questions?
I think it's been probably close to 2 weeks since the original non-resident from New York tested positive. Is there an update on her case?
So we never released the information about that case, so I won't even begin to confirm that now, that personal information. And no, I don't have an update other than all of the cases we have mentioned are in isolation and recovering.
Would you guys put it out if they pass away?
If there was a death in our community, we do provide that information, yes, that's related to COVID-19.
According
Yes.
to that, sorry.
Go ahead.
According to that map, the Bakersfield West and East are where the predominant confirmed cases are recovering now. The majority of the pending tests, would you say, are in that area as well?
No, I don't know, and I couldn't answer that. Yes, one more question.
So last night we learned about a 5th case. This morning we understand there are 11 cases. So it's more than double. How did that happen overnight? Is it that the testing centers were closed over the weekend and this morning they opened back up again? Or could we say that the rate of infection is spreading that quickly? Overnight, more than doubling the number of cases.
Well, we have increased, there are more locations coming forward doing the testing. So the more tests that are being conducted, we got noticed just before I came here about many of these cases. They came in this morning. So how that flow works, I'm not able to verify that. But what I can say is when there is a suspected case, when a test is happening, those labs and providers are supposed to, by law, let us know that those tests are being conducted. And certainly when there is a confirmed case, we are immediately to be notified. So what I'd like to do is offer up after this, we have Spanish, Eli Bajorquez, our Spanish-speaking PIO, who is available for one-on-one interviews if any of you would like that. And thank you so much. Follow us on social media and visit our website for ongoing updates. Thank you.
All right, and you've been listening to a news conference by Kern County Public Health. That was PIO Michelle Corson giving us the latest numbers. We've just learned that in total now there have been 12 positive tests for COVID-19 in Kern County. That includes 11 residents and 1 non-resident. That's quite a surge over the weekend. We were notified there were 2 additional tests, bringing the total to 6. And now this morning they have just doubled that number, telling us there have been 12 positive tests total here in Kern County. They broke down those numbers a little more by region for us. They say that now they've reached a certain number of positives. They can continue to break down that data a little bit more for us. Here's what we know. 1 is in what they called the Valley region, which is kind of north and west of Bakersfield. There are 8 positive cases in the Bakersfield West region and 2 in the Bakersfield East region. Again, there's also that 1 non-resident who tested positive. That was the first positive case identified here in Kern County. A couple of other key takeaways from that news conference that just wrapped up. Michelle Corson said there are no shortages of masks for our medical personnel here in Kern County currently, and that they cannot, in fact, use homemade masks as approved personal protective equipment in hospitals. And they also continue to say there are no shortages of tests to be had here in Kern County. Several locations are conducting tests, including Priority Urgent Care, Omni, and Accelerated Urgent Care, as well as the local hospitals. And another key takeaway, they now do believe there is community transmission happening, meaning these are not all travel related, although they did not specify. They say it's all being investigated still, but they do believe that transmission is happening within residents here in Kern County, and reinforce the importance of social distancing, keeping your 6 feet distance when you do have to go out to conduct those essential services like going to the grocery store or going to doctor's appointments. If you have to do those essential services will still be there. They will still be open under Governor Gavin Newsom's order last week. However, just do so in a safe manner, keeping that 6 feet distance between you and the person in front of you in line. And another key takeaway here, we don't know necessarily how these people are doing. They can't release the information on these 12 patients here in Kern County, but they say they are all recovering in isolations and would not differentiate how many were at home and how many were in the hospital. I want to just put up this one more time for you. If you want to check out more information on coronavirus, we have it all for you in one place on our website, kget.com. Click on the banner at the top of our webpage there. You can find out symptoms. You can find out where to get tests. You can find community resources and a list of services that are still open under Newsom's order and those that are now closed because of this. Again, the biggest news this morning that we now have 12 confirmed cases of COVID-19 here in Kern County. We'll have much more on this coming up today throughout the day at kget.com, as well as on social media and of course on 17 News at noon in about an hour and a half. Thanks for joining us. I'm Maddie Jansen.